Technology in healthcare, from the world's oldest prosthetic devices dating back to 950 BC, to the first computers in hospitals in 1980, to artificial intelligence potentially revolutionizing medicine soon. In this podcast, we're going to get real about healthcare and explore how technology has helped and hindered medicine. Here's Robin Weiner.
Hi everyone, welcome to Get Real About Healthcare. I'm Robin Weiner, I'm your host today. I'm the president of Get Real Health, and I'm really excited to have with me today Wes Cronkite. Wes Cronkite is the Chief Innovation Officer at CPSI. CPSI is a parent company of Get Real Health. They provide the leading provider of healthcare and solutions and services to community hospitals, clinics, and post-acute care facilities. A little background on Wes. We are very proud, Wes. He just recently graduated from Harvard with a Master of Information Management and has been working with us for, gosh, can't believe it, a year now.
A little bit over a year.
Yeah. How exciting is that? Thanks so much for joining us today, Wes.
Oh, glad to be here. Thank you for having me. Excited to chat.
It's going to be fun. So one of the first things we love to do here is to kind of get to know you a little bit. Right. I'm going to ask you four rapid questions. So we get to kind of know you. I know you're like, oh no, what is good? So just so we get to know Mr. Wes.
Let's do it.
Okay. What are some of your hobbies? What do you love to do?
So wintertime, I'm a snowboarder. So do love to snowboard, get out to the mountain when I can, and that's definitely my winter sport. The rest of the seasons, playing guitar. So a little bit of acoustic guitar, out by a campfire kind of thing is definitely a hobby, and doing whatever my kids want to do, honestly.
Exactly.
Has become my hobbies of watching them get into theirs. But that's probably about it.
Well, that's good to know. We have a guitar in the back, so
great.
We might have to give that a little try later.
I knew these were trick questions.
Yeah, exactly. What are you reading or listening to or binging right now?
Oh, those are good questions. I'm an audiobook guy, so I try to listen on the plane, in the car, on the train when I'm coming here.
Yes.
From New Jersey to the DC area is a nice little train ride. So I'm getting into Malcolm Gladwell's stuff a lot. Outliers is one of the newer ones that I've been I think I'm halfway through that. But I'll be very honest, taking a little break from reading. The school that I just went to requires a whole ton of it, so I had stacks and stacks of books, but I'm taking my time through that one through the summer.
Yeah.
And binging a little bit on not reading and enjoying my couch for right now.
Yeah, you should. You worked really hard. Yeah. All right, I think this one's really cool. If you could have dinner with any historic figure or current celebrity, who would it be?
Oh, that's an easy one. Elon Musk for me.
Really?
Yeah,
really?
Current celebrity. Yeah, I would love to dig into just how he's able to do what he does, the things he's been through, and really get the true raw story from him on how he got to where he is.
Can you ask him why he pulled out of Twitter? It could be interesting.
All of those questions.
The news in the last 24 hours.
All of those questions. I don't know how many of them he'd answer, but
the news in the last 24 hours could have really been interesting.
Exactly.
What would you like the world to look like in 5 years?
I think I'd like the world to look, I guess I wouldn't want to say technology enabled, but I would say a little bit more balanced when it comes to technology. This is more on sort of the personal home side of the fence, but I do get very concerned with the amount of technology that's embedded in children's lives and sort of how much of that is in the culture, and just a way for us to get to a place where, yes, it's bringing the value of making things more efficient, getting more, opportunity in people's hands, being able to drive for those benefits, but not having it be over the top in, it's taking away from some of the things that, we enjoyed during childhood and growing up, and really getting to a place where there's a healthy balance there, which I feel like we're starting to tip in the other direction, unfortunately, right now.
Yeah, I think I miss having the kids go out and have their imagination.
Yeah.
Go out and here's a stick, here's a ball, go figure it out, or build a fort and things like that. They're getting away from that. They're playing more video games and things like that. So that's a really good.
And I think that wraps around, and even in my role today and kind of why I'm in the healthcare space is make a good impact with technology. And if you're not, let's really start looking at, what those companies are doing, what those industries are doing, and ensure that, the technology is being used for good most of the time and not, for profit or evil.
Absolutely, absolutely. Well, that's perfect. We're going to kind of talk about exactly what you do.
Right.
So one of the things is you're an innovation officer. Okay, what does that mean? Like, it's kind of a newer chief, kind of out of the chief innovation officer. What does it mean in the industry, and what does it mean to you?
Yeah, I think in the industry, it is something that they'll put, at that kind of C-suite level, saying that we are very dedicated in thinking about things differently, driving for more modern use of technology, driving for heading where, either our competitors or our industry needs to head in terms of just not doing what we used to do for X number of years. I think that's sort of the concept. So it can be pushed, from managers and kind of supervisor level in certain companies, but I think when you truly want to go there and say, yeah, we're going all in on getting, doing things differently, then you kind of create that role of having someone in that seat that is incented to do that, and that sort of shows the company and the board's commitment to, yeah, we're going to go after doing things differently. I think the kind of industry, and especially the healthcare industry, it varies a lot, right? I think there are some roles where that is what's going on and we're trying to push things forward. There are others where it's just, well, we've got to kind of come across as innovative, but at the same time not really fund it and not be too serious about it. And it's more of a, kind of someone that's in the newspapers and talking about it a lot, but then if you look behind the covers, there's not a lot of execution. So I think that is a lot of what I see sometimes in the industry as well.
So you're coming into a company that has been around for 40 years. So trying to pull them forward, how is that sometimes? Do you find it, adventurous? Is it sometimes frustrating? Is it sometimes a mixture of all?
Yeah, I think it's overwhelming, I think would be the word. I don't think I'm frustrated. I don't think that there's, honestly, coming in a year and a bit after, after joining here, I don't think there's that much real hard pushback or walls that have been put up. There's been a lot of support. There's been a lot of employees that have played along. We just opened up a Dream Factory Challenge for the month of August that's actually going on right now, where 144 employees have joined together to start going after new things that they've never been able to get done before, whether it's healthcare regulations, whether it's not having enough resources, not having enough bandwidth to get it done. So they're now at a place where they want to play along too, which is very cool to see. But it is overwhelming. There's a lot of technical debt. There's a lot of old systems. There's a lot of healthcare regulation that hits you on the side of the head. It's a tough spot to really get things moving and get them kind of pushed forward. But it's a challenge that I'm used to. I've been in this industry for some time. It is the way this goes.
It is the medical.
Yeah.
It's hard to believe that some EMRs still use MUMPS technology, which is a technology that was done the year in 1964.
60s, yeah.
Right.
Yeah.
So if you look at that old technology, you're trying to jump from some companies are still doing that to some of them using the newest technology. So it's a long road. Thank God CPS is not there. CPSI is moving forward, but still, it's so it's not just our company, but it's multiple companies out there. Yeah. So it is good. Why was it so exciting to join CPSI when you first came in? It's been a year now. What was the, oh my gosh, I need to go do that?
I was aware of CPSI, kind of, again, from my industry background, and kind of worked with companies that either had to integrate with their systems or knew of what their platform was. I was excited as I understood more that, they aren't just an EHR platform. I think that's sort of the kind of thought process out there in the industry is, well, CPSI builds EHRs for community hospitals. When I found out, they also do the post-acute space, and then we've got this awesome Get Real Health solution. We've got TrueBridge Revenue Cycle Services, and we've got also a platform that surrounds that. We just picked up TrueCode. It was very exciting for me this is not, just an EHR company. They are growing and they're making an impact, and also, again, their systems are at a place where they haven't seen the unlock that can happen with modernizing, with getting to the cloud, and with being able to do so much with the data. So from my personal perspective, I'm like, there's a huge impact here. And yes, some of that will hit the community and rural space, but that's exciting for me too, because those are struggling hospitals that are trying to deliver care out there, in these islands. That's very
a tough
difficult.
area.
And so thinking that through and saying, this is a cool challenge. There's a lot of support. There's an opportunity to really do this, kind of my way, if you will, of knowing the systems I want to put in and not having to, replace existing ones too often. And really be able to make that happen for the enterprise was exciting for me.
Especially when you look at rural America, you could really make a change.
Yep.
Just by throwing a couple new technologies inside there could
Yep.
just make the change for, when you get down to the patient.
Yeah.
Sometimes because of technology, they're not getting the best care.
Correct.
And we're bringing the tech down, we talked a little bit on the last podcast about bringing virtual care in now.
Right.
Being able to see doctors outside your small, limited area.
Yes.
Being able to be exposed, but you have to do that with technology.
Correct.
People can't afford to get on an airplane and fly to Washington, D.C., right? But they need to talk to that doctor in D.C. So I think some of the things you're talking about is really
or they need
powerful.
access, they need the pathways to even the specialists that, it's very difficult to figure that out in a small rural community. And so any way we can help drive for those, decision points, drive for data and information that'll help them guide the right pathway is a meaningful impact to me.
It is, and it's kind of cool when you can get it down to that level.
Yeah.
Because we live in this level sometimes, and to be able to actually see the impact.
That actual true impact.
And I think in a smaller hospital system, you're going to see that a little bit more clearly than in the large Johns Hopkins and MedStars and things.
Correct.
So we talked a little bit about Dream Factory. Tell me about this baby that you have here. This is like,
Yes.
This is your thing, right?
This is my thing.
This is your thing. It's super exciting. Talk about what your vision and where it is now and where you see it in the next 66 months to 12 months out.
Yeah, absolutely. So the Dream Factory kind of month challenge that I mentioned is a piece of it, but really what the Dream Factory is, it kind of answers your question for both our employees, customers, or stakeholders of, what is innovation, right? You can stand up a chief innovation officer, you can have an innovation team, but what is it all about? So Dream Factory is really that. It's telling our employees, our customers, that we're committed to innovation in a way in which we want to get to a proof of concept as quickly as possible. And then the Dream Factory is really the mechanism to do that. So what we've done is we've opened up ideas portals both to our internal employees and to our clients. We're allowing them to submit their ideas. People can vote up the ones that they think are really impactful. And then we have a really great list to look at to say, okay, let's put some of these into the Dream Factory. So what that means is it's not going to hit the teams that are working on our big platforms and systems that already have what they need to deliver out on their roadmap, but we're going to have a separated group that can go in and get after these things and get them to the point where it's something we don't just talk about. It's not on a PowerPoint. It's not in a conversation. It's a tangible demo that we take a look at and say, okay, let's take that further. That's a really good idea. Yeah. Or, you know what, that really doesn't work in our industry, or that's not going to work with the data we have. But it's a quick turn, exactly, quick turn. And so we've staffed it a few different ways. We've got, again, internal employees of CPSI that are working on Dream Factory approaches. We've also built out partnerships with universities. So we've got partnerships with University of Maryland, we've got partnerships with the University of South Alabama, and we're growing that over time into more and more universities that have internships going on, managed internships, people that just want to get involved in the healthcare technology industry. And then from there, we're also open to opening this up to external partners. So other players in the industry, other startups that have digital health concepts, come on in. We've got a big customer base, we've got data. If you've got a great idea but you're stuck, which happens a lot in the digital health world because you just don't have the connections or the amount of data you need or access to the data to really try something out, let's pull that into the Dream Factory as well and see what we can get moving there. So that's a bit of where we're heading. We also have talked about even crazier ideas that if employee teams get to a concept that really could be a startup business, that we might actually fund that and fund that through CPSI so that they can get the backing they need financially to push things forward. So it's going to be fun to see this progress. I think it's been a fun ride so far, and we've had a lot of successes, and we've had also an innovation. Some of these things stumble for a bit, and you figure out that's not the right fit. But
better to stumble there than putting a team of 4 teams on it and spend 6 months.
Exactly.
Right.
Right.
Stumble. Test early. fail early,
Yes,
move on.
that is for sure the model.
Yeah,
Yep.
because I think that is
Fail
where
fast,
it really is. But I think it's fantastic for the organization to be thinking forward, really thinking forward and figuring out what is the next cool adventure.
Yes.
What is. And I know just being, used to be a startup and moving into this, it's the kid in the garage that's putting something together, or the guy that's so darn frustrated because something's wrong and finally comes up with that really killer app. Those are the guys we want to inspire.
That's right.
Right. And
that's
that's
and we want to give them the support, and we want to give them the ability to really get in, because healthcare is hard. It's hard to break through.
It is hard.
It's the connections you need, the data you need, the ability to understand the regulations, all of those pieces coming together. It's a lot harder than other industries. So.
It really is. It's not as some of the other ones that just go quickly, oh, I can do this really cool thing.
Yeah.
You got to make sure you're doing it in the right way. That just leads us right into like the whole idea of like with healthcare, why is it so critical for new innovation?
Yeah.
Why do you think it's like?
Yeah, I think coming out of what we came out of over the past couple of years and the pandemic, it kind of showcased very quickly that we need more digital solutions in healthcare. We need more ability to have virtual visits and be able to interact with patients in the way they're expecting to be to interact. And so that was a big eye opener for the industry. I think with some of the regulations backing up on telehealth was fantastic, and I don't think that's going to change. I don't think that door is closing again.
Yeah.
And it's just
too wide open.
It really was a pretty bright spotlight on the fact that we need innovation badly in this part of the industry. And the cool part is that a lot of investment has followed, into kind of venture capitalists. But again, I think it's one of those situations where it's going to take a multitude of different organizations and stakeholders, both public, private, across the board, to really make the impact and change we need to make. And it couldn't be more needed than now.
Absolutely. And one thing I know that you're really passionate about is data.
Yes.
Right.
Yeah.
And I think about what's happened during the last couple of years and how good piece of data with AI on top of it could have driven maybe better results. So why don't you talk a little bit, because I know this is what you went to school for, and also it's something you're incredibly passionate about, is data, using artificial intelligence, figuring those pieces out, and saying.
Yeah, I think that is core. I mean, of course, the interoperability problem around healthcare has been around for over a decade at this point, maybe more.
At least.
I mean, that is the sad part of the HIMSS conference every year, is walking through that wing. But I think as we now have the ability to do more with big data, with cloud technologies, and it's not as expensive as it used to be when you had to stand up an entire on-premise server farm to try and
Thank God for
deal with all these gobs of data.
Yeah.
The cloud's making it a lot easier. Those providers are making it a lot less painful and a lot quicker to get to some of these answers. And then just the amount of talent, and that is, why I went back to school, was I was in a role prior to this where I had data scientists on my team that were speaking to me about, all sorts of Python words and pandas and numbies, and I'm like, I don't really know what he's talking about. This is not good, because I have to make a decision of whether this model is going to do a readmission model is really the right answer or not. And so I did a ton of research on my own then, because I was anxious about it, but I really knew I needed to get further in my understanding of that, because it is such a possibility now to just go in with data scientists that understand those lighter weight technologies that can dig into a ton of data, accessing publicly available data from CMS that's pretty easy to get to now through an API, and then getting to a lot of insight. And there's just not the technical talent in a lot of these healthcare facilities to get to that insight. So the people who can help and own that data and sort of help them unlock that insight is going to be huge for the industry.
And I asked, looking at we talked a little about this before, talking about the Great Resignation, right? Mm-hmm. The lack of staffing inside those hospital systems now is so tight.
Yeah.
So being able to come with good data to maybe actually help them, do you see that? Where this could really play not only in innovation, but also on the data side of it, and being able to do something with that.
Oh, absolutely. I think where that's happening a lot now is more in the back office of the hospital, right? The administrative functions like the revenue cycle and coding and those types of areas that are very rinse and repeat, transactional, type of roles typically, but have a lot of critical thinking within them. So what we've done for our teams that run our TrueBridge service line that provides that support for hospitals that just don't want to or can't afford to staff it themselves, is we've lit up robots. So robotic process automation, which is a flavor of AI that really can see and understand, okay, they're going to this website, they're clicking this button, they're going over here. I can kind of watch them do all of that, and as long as it stays the same every time they do it, we can record that and have them do it at robot speed and get that transactional piece off of their plates. So that helps a lot with kind of staffing concerns and it being so tough in the market right now, because now those people are either freed up to do a lot more of the critical thinking work, or we can just do more with less people in those back office functions because these bots can tackle that. I'm excited to see that start to turn as well into the clinical care component. These EHR platforms, and we're not innocent of this as CPSI or AHT, are not easy to navigate. There's screen after screen after screen. They've been built up over decades of all the needs that have come about for hospitals, and so ways in which we can potentially use AI or even tools that can understand voice recognition and be able to say, I want to pull up the order screen, have a bot that goes in and fires through the 6 different steps you have to take to pull up the order screen.
Or when you want, yeah.
And it's right there. Now you're saving, a tremendous amount of time and stress on clinicians that are already super stressed because they're working longer shifts and have, more full facilities than they've ever had.
Absolutely. And I guess sometimes people worry that are these going to take jobs away, or are they maybe actually going to create a better road for people.
Yeah, and I mean, I think of the analogy of, when taxi cabs showed up and we were in the horse and buggy world in New York City, right? It didn't take the jobs away, right? They figured out that they could become taxi drivers and they kind of worked with that technology. So I think it's a similar situation here. It gets people out of the transactional crazy and gets them into a place where they're doing critical thinking and decision.
Which is great. It just keeps on
moving. Gets you excited to work, right?
Yeah, no, and I think so many people are wanting to, they don't want to sit there and just do something rote. They want to grow their career, so they're going to be able to do it. That brings it up is, why is healthcare always behind on this stuff? I mean, it's like why is this constantly happening? It
is a tough one. I think, again, regulations and the way we roll those out and the expectations on healthcare technology organizations to keep pace with those doesn't help. Now those regulations are put in place for a reason. It's not like I'm saying they're poorly thought out or poorly built, but they hit pretty quickly. There's an expectation that these systems are going to keep pace, and that adds a ton of work that you've got to kind of consistently be keeping up with, and then another one drops and you're after that. Also, just the lack of standards around data and data models. We're getting there. It's getting better. FHIR is helping a ton in that arena and is bringing a lot of that to light, but the lack of that for so many years and so many systems that were built just wild west on how they were building out their data formats or the data structures. Now nothing can talk to one another, and that also prevents.
And then you also have the large corporations that don't want to share that data.
The walled gardens, as they're called.
The walled gardens, right. Which is so frustrating because it should be about the patient care.
Exactly.
And they're trying to hold that data. Data is worth something. Yeah. So they're trying to hold that data. But I think some of the regulations have opened it, but we need a little stronger to make that absolutely happen.
Agreed.
It's an exciting time in our world right now because it is changing, it is expanding, it is going to get there.
Yes.
But I would love the day when I can go up to a machine and be able to get all my health care just like I do for my banking.
Exactly.
If I am in any country, I can go ahead and hit my ATM and I can pull out my money, and it might come out in pounds, but I can still get it.
Yeah.
And I think that's where hopefully we'll get someday to be able to do that. I think this is like the exciting stuff that's going to happen out there.
Yes.
Just trying to think of where, as you grow your team, you grow all these different things, what kind of talent do you look out there for? Because it is, again, it's a really hard time to go out and find people, right? Where are you looking, and where are you, how do you're looking at some of these universities, do you see that talent starting to come up? Are you seeing talent in different areas? How do you bring that together?
Yeah, it is a difference now that again, where I get to around cloud technologies making things a lot easier, there's a lot less of a need for like a deep technical understanding of a programming language or a particular it's much more about drive and sort of passion and the ability to kind of research. I mean, there's so much out there that's available. There's so much data that's out, online to teach you what you need to know. So I look much less around the technical qualifications, and I base it much more on, is this someone who really can explain how they went out and figured something out on their own, how they went out and researched and understood exactly what the problem was and could find the particular technology that fit that problem and plugged it in and can speak to that. And I think that is starting to also turn the heads of some of the ways in which universities and sort of training institutions are modeling things. They're not basing it so much on, okay, we're going to deliver, let's say, an Oracle database class, right? They're basing it more on, okay, we're going to deliver something around kind of database best practices so you can understand the concept, and then let you run free on a project where you can go and choose whatever technology you feel like you want to solve a business problem. And I think that shift is exciting to see, and I think that also, tying in that and bringing in talent is you want those types of folks that really understand.
And we saw that a little bit at Maryland with the capstone projects, right?
Yeah, we saw that too.
Where I thought was so cool to go in and first off, our future is bright. The talent at these universities are like, wow.
Oh yeah.
They've been playing with computers since they were born.
Yeah.
So they really get it, right?
Yeah.
They've been playing around with it. They've been doing it. But I think the difference is the concepts, is to be able to think through the problem, critical thinking. Yeah. Critical thinking is out there, and I think it's great that you have tapped into those universities, because I do think that's where we're going to drive that really cool talent that's going to not only just do on the cloud, but also the development and actually keep us at the cutting edge. I mean, you and I both have teenagers, and I show them something or one of our apps, and they're like, really? Yeah. Like, what is this?
This is all this does?
Yeah, this is all it does, and why doesn't it look better? And then you go, ooh, wait a second. Yeah. I better go fix this, right? So I think, looking at that and keeping us at that edge, and always developing just two is kind of cool. It's really, really kind of cool. As you're watching the industry grow, where do you think there are some spaces that are missing right now? What are some areas that might be, wow, only if somebody was doing this well? I mean, we know what we do here, but like, what's missing across the industry that you would love to see something like, as an innovator? You're like, oh my God, would somebody just come up with this? So let's say that in healthcare, and then just in the regular world.
Yeah, I think that, I guess a mobile-first approach when it comes to technology is missing. And again, something we do well here in the Get Real Health side and other areas of our business. But if you look at the holistic platform set of healthcare technology companies, a lot of it was built for sitting behind a computer, and nurses don't sit behind computers, or they shouldn't be, right? And same thing with even the back office staff. Like, why do they really have to be? Like, the world has gotten so much more mobile. It's gotten so much to a hybrid workplace or a primarily work from home workplace. People are on the go. They're doing more, and they're expecting to be able to do what they need to do on devices that are not tethered to desktop computers. So I think that, I would say, is definitely missing across the industry. And then again, the unified data model is something that a few organizations are chasing. Some of them, the right way. Some of them more selfishly. But of course, there's even there's just general, public organizations that also are surrounding this problem. But I do think it's something that really needs to happen shortly for us to keep pace with what is required and really get more comfortable, like other industries have, in a platform model than I have to go out and buy everything I need all in one big chunk of technology.
And especially as the world gets flatter, right?
Exactly.
So we're here in the United States, but we have clients really around the globe.
Yeah.
And being able to share data with us here and us overseas, do you think that's something that eventually will actually truly happen?
I think if we can get to standard models and we could figure out where the overlap is in those data structures and potentially the overlap in regulation, I think that's definitely a possibility.
How do you think about taking innovation into some of the emerging markets or kind of the third world, where we could do, especially the mobile first?
Yeah.
What kind of impact do you think that would happen in some of these countries that are struggling a bit right?
Bit,
And
yeah.
then and now we're bringing in, we are bringing in better Wi-Fi to those. So
I was
have
going
you
to say we got to call Elon. In my Elon dinner conversation, I'm going to ask him about his,
exactly
his Starlink Wi-Fi
That's
system.
right, like,
and
like
then
exactly.
and
It's in
then we
Ukraine,
got-
right? It's helping in Ukraine right now. So, what would that be a cool thing for you to see? Do you think that-
Yeah, I think that'd be incredible. I think, again, in those markets and country, everything would need to be very lightweight, again, very mobile friendly, very low cost and sort of light. But it's possible. Again, anything's possible. You can make things happen in those end user devices that you'd be surprised can actually, things you can do with a camera for exams or things that can happen just with a few different data points being captured could really make a big impact. And
you think about that data coming in, right? So as the World Health Organizations are looking for different spots that are happening here, hot spots, or looking at famine in different areas, that data could be really rich and could really focus humanity on going after those
where the
areas.
problem areas are.
The problems areas.
And I mean, big modern data warehouses allow for that, right? You can stream that data, you can get it off of wearable devices, you can get it off of mobile devices, and you can make it happen. It's just a matter of.
And the expense of these are going down.
Correct.
Right. All this expensive, and I think that is where it gets exciting when we start talking about all these new devices that can be worn, in your hand, all those kind of things. So.
Absolutely.
The world is wide and
We're
exciting, right?
We're getting there.
Absolutely. Is there some things that you might want to talk about a little bit? Thoughts?
I think I'd love to hear. I know you've kicked off this podcast recently, and you've had a lot of thoughts around what you want to see next. I'd love to hear a little bit from you of what could be the next thing to go into the Dream Factory. Like, what is the stuff you would hear from your industry partners? And I love as well the international, right? Because we don't get much of that input. But what is the next thing that could pop its way in there to really prove itself out?
We're definitely on the data side. I mean, there is this real need to be able to bring information in, and talking about the care paths and being able to share those care paths across the different countries. As much as we're all just Americans are so different from everybody else. Guess what?
Yeah.
We're not. Everybody has the same problems, right? Across. Is actually taking some things and unify them into a way that can be done in different languages, which is incredibly, we do that here, incredibly important. But to be able to take those and repeat. But that way, citizens are actually feeling they're getting the same thing. So I do think coming up with some care paths and some things that can get good results out there, that they can be easily just popped in into EMRs, into patient engagement tools, digital front doors, those kind of things. We hear that a lot from our clients as, do you have care paths? Do you have care paths at work that can be just adjusted to follow the regulations of those countries? Versus building one separately for Sweden, one for Scotland, one for et cetera. Centralizing all that. But being able to take, especially that data with inside, like the EU, be able to take that data, be able to do it and actually, again, take the data and figure out where can we get people healthier, because outside the US it's all social medicine, and they want to bring their taxes down. And the way to bring your taxes down, because you're paying, it's healthcare is free. No, it's coming out of your taxes. So how do we do that, and how do we and break that down in a way? And again, just bringing in with the easier to use. The audio side of that. So that's what I'm seeing, but I think data is king, and making it simple is definitely king. Anything else, Sue?
Well, just reacting to that, I think that plays really well with the goal to unify all of this data, right? And I know that's going to be much harder as we get out beyond the states, but I think that enables what you're talking about, right? To be able to say, okay, now that we've got this unified data set that we can now analyze and understand these care paths and be able to say, okay, this is where it gets a little wonky over here, right? We don't see this streamlined workflow here. There's a real problem. But also to say, okay, now we've got that locked, and we can, for anyone who's under the same regulation set it. There it is. That's pretty cool stuff.
Well, it's interesting, the data flows. So here in the United States, it's probably harder than anywhere else in the world, because it is social medicine and the other ones, and they do go through government. So there it is. It's a little simpler. but making sure all the same regulations and be able to share. And they do look at the U.S. as best practices sometimes, and to be able to expand that out. So it's exciting. I mean, we get to do that a lot.
Yeah.
So as we're kind of getting to the end here,
Yeah.
I asked you what you see the world in 5 years. Where do you see, and we talked just about generally in our own world, where do you see the world in 5 years in healthcare?
I think I see the world in 5 years in healthcare in a place where delivering care is simpler. That's winning to me. That's a very aspirational model, but getting to a place where, as a care provider in any setting, whether it's a hospital, which is probably going to shrink a bit, whether it's urgent care facilities or ambulatory surgery, which are going to expand a little bit, but just have a way to make that as simple as possible. So again, they're not burdened down by administrative tasks or clunky technology and software, and really can get to the bedside, really go after the best possible delivery of care they can. And the rest is easy. That's my hope for 5 years. In reality, 5 years goes like a blink of an eye. But I do think there's enough progress out there in the industry and enough people going after this that the companies and the organizations that are thinking down that road are going to be starting to kind of elevate themselves amongst the rest. And I'm hoping that brings a groundswell of value to those delivering care, and then of course on the patient side of the fence and the stuff you guys take care of, and I think that also will become critical. I think that patients are going to have very high expectations, especially as more and more of them come along that are from the younger generations of, this is what I'll be expecting in terms of the technology I interact with, and it will not be
they're not going to put up with
you
it
see today.
They're not going to put up with it. They're going to so again, I always say the future is bright. It's exciting. It's an exciting time in our industry.
Yes,
it's
an
exciting time to see what's going to, but it's an exciting time for you. You're about to have a big birthday.
Yes.
And your first son went off to college.
That's right. Exciting and terrifying, both those things.
Exactly.
Yes.
But thank you so much, Wes, for joining us today.
It's great.
Get real about healthcare. That's what we are, and what we talk about, and we look towards the future, because let's talk about what's good and what's bad and figure out the best solutions. So thanks again, Wes.
Thank you. It was great being here.
Great, Wes. Thank you.
All right.
The Get Real About Healthcare podcast is a production of Get Real Health. If you want to hear more of our interviews with top healthcare and technology innovators in this industry, be sure to follow us on social media at Get Real Health and subscribe anywhere you get your podcasts.